My name is Abarbanell, and I am a congenital heart surgeon. I'm part of the UT Health San Antonio faculty, and I work at University Hospital, and I operate on children and care for children and adults who have congenital heart disease. Congenital heart disease implies that there is something that didn't form correctly in the babies when they were born. It could be a valve, it could be something major like missing parts of the heart or having problems with the actual blood vessels of the heart going to the body. And so as such, they sometimes will need surgical correction for this. And oftentimes, if they do need it, they'll need more as they get older. For me, the journey to become a doctor and especially a congenital heart surgeon was long. I actually was a naval officer before this, and I worked in industry selling surgical devices. And it's when I was selling surgical devices that I really realized I loved surgery. And then in medical school, I realized that I loved working with kids, and especially with kids who had complex problems and complex heart disease. What makes me excited to get up and come to work every day and take care of these kids and adults with congenital heart disease is the fact that they are some of the most grateful patients you can meet. The challenges of getting them through an operation, the challenge of caring for them postoperatively, and the challenge of caring for them throughout their life. It's an exciting time. 40, 50 years ago, a lot of these kids couldn't be saved, and now we can do it. So it's an evolving field, probably to me, one of the most fast evolving fields since the 1950s. I think for us as clinicians, the biggest thing we can do is provide constant and continuous communication and reinforcement, always asking, did we explain this well to you? Helping them to understand what the problem is and what the future has for them. Because it's scary to have a chronic medical condition that you don't know what the outcome is going to be. And so for us to provide reassurance and education at every visit, I think is absolutely essential. I've been very fortunate to have a lot of patients and families who have touched my life personally, and each one of these patients has always left a mark on me as well as their family. And one of the things I've really learned is that it's what the patient and the family are telling you is so crucial. There was a patient who came for me to be evaluated about 8 hours away from me, and she was a teenager, and she said, "This is my problem." And she'd been to 13 other doctors of various specialties, and I said, "I just can't believe it. That's not true." And she said, no, you have to watch this YouTube video. And I said, no way. And she was right. She was right. And we went on and did the procedure that she needed, and she's done great. She's probably going to be a Division I NCAA athlete now. And it's all because I just took the time to listen to her story, do the research. It's something I'd never heard about before, never learned about in medical school. And this lady has changed not only her life, but changed how I practice. And then after that, I did like 12 other patients with the same problem. It's incredible. Yeah, it was really neat.